Hello, everyone, and welcome to the Esperanza Nurse Practitioner Postgraduate Primary Care Fellowship Virtual Open House. Here's our agenda that we'll be covering: brief introductions, an overview of Esperanza, an overview of the fellowship, and then some general information about the application. My name is Demetrius Markolides, and I am the director of the fellowship. I'm an adult gero nurse practitioner, and I completed a nurse practitioner residency myself at the San Francisco Veterans Health Affairs Administration. So I'd like to just quickly review the values of Esperanza because they're really woven into the fellowship and drive almost all of our patient care decisions and organizational decisions. Caring, quality, and family are the values that we're really looking for and try to emulate every day. We started in 2004 in the predominantly Latinx neighborhoods of South Lawndale with just 2 providers. And today we are a federally qualified health center with around 330 employees. We have 5 different sites. We offer clinical services across the lifespan. We have 4 specialty service lines that I'll review later. We have integrated behavioral health, medication-assisted treatment, offer both in-person and telehealth services. We're one of the leading providers of COVID-19 testing and vaccines in our neighborhoods. We offer benefits enrollments for our patients. And then we have comprehensive care management and coordination. The care team model is similar to many other federally qualified health centers in which the patient is at the center, and around the patient we have support from all the team members, whether it's a provider, a medical assistant, a care coordinator, or our patient service representative. And then as needed, we can loop in psychiatry, behavioral health, and our nursing support. I showed you a little bit about where Esperanza came from and where we are now, but where are we going as an organization? The following areas are where we are really striving to strengthen and expand our organization. And as fellows, you fit into this in a really important way. We are expanding our community presence by opening some additional buildings in the next 2 years. We also have a violence response team when there's violent incidents in the city, in our neighborhoods that we take care of. We also offer space for local organizations to meet. We're nonprofits as needed. And we're one of the largest employers in the 5 zip codes that we serve. And that's really important to us. Not only do we get to care for the people who live here, but we get to offer career development opportunities for the people who live here as well. The impact is we're always striving to improve the health of everyone in our 5 zip codes. And we really try to have a tight focus because of our unique population, how the unique cultural and health needs exist within that population. Quality. We're a consistent achiever of the top national quality scores from HRSA, and we really strive to continue doing that. We've been a leader since 2016, and we rank consistently in the top 10% of federally qualified health centers nationally. Some years top 5%, some years top 8%, but always up there. And that's a really important piece to us. We have a dedicated quality department and regular quality reviews to support these goals. And talent. So we're always looking for the best providers possible for the patients who we care for. The fellowship is an excellent avenue for this. As well as some of our future plans, which include launching a physician residency, which will be starting this summer. That's going to be an amazing opportunity to create interprofessional training and development while elevating both nurse practitioners and physician's assistants at the same time. And we're very committed to equity amongst providers. This is the staff of the fellowship. I'm there on the left, and then the rest of our current preceptors and staff are there, faculty are along the line. Carol Kinderberger is our adult medicine and lead preceptor, Michelle Yacht, one of our other preceptors, Tiffany as well, And then Ana Cortez is our program and medical department administrator. Various other physicians, nurse practitioners, and physician's assistants serve as preceptors and faculty members throughout the year. In addition to our serious business faces, we're just a fun group of people who are really committed to taking care of our patients and developing that sense of family in the organization. We also are partnered with the Community Health Center in Connecticut, some of the leaders in the Nurse Practitioner Fellowship movement nationally. So we'll be interacting with them at various points during the fellowship. So a little bit about the past fellows. This is our original cohort. And this we have Angelina Bravo, Melissa Martinez, and the program founder, Jillian Connolly. I share these because I really want to kind of continue building that sense of family and connection. This is our second cohort. We have Yesenia Bailey, Cielo Valandia, and Agnes Glowick. And there's our CEO, Dan, and they're out on a walking tour of the neighborhood. And this is our current cohort, Roberto George, Laura Campa, and Becky Serna, and with one of our office managers, Ilda Lopez there. That's the California site, and that's a quick glimpse into your main site where you'll be working as a fellow. Well, so a quick overview of the specifics of the fellowship. It's a full-time commitment, 12 months in the fellowship, 40 hours a week, with a 1 year of employment commitment after the fellowship. There are 3 types of clinic in the fellowship. The precepted clinic, where you will develop more of your own personal continuity panel, which has a slow ramp up. It starts at 1 patient an hour, and by the end of the fellowship, you have scheduled 24 patients for the day. The mentored clinic is working one-on-one with a mentor, and that way you get to kind of go a little bit deeper on your education, develop those mentoring relationships, and see acute and chronic continuity of care. And then we have the specialty clinic as well, which I'll talk a little bit more about on the next slide. There are no evening commitments at the moment. We may request weekend commitments in the future, but that is undecided. Call starts halfway through the year. So this is for overnight and weekend calls, but you'll be paired up with a preceptor during those calls so that you have the support you need to take good care of our patients. Here is a sample schedule, so you kind of have a little bit more in-depth look of what you'll be getting. There's 2 days a week of precepted clinic. There is 1 to 2 days a week of mentored clinic with a faculty member or another. There is, some of those days then are replaced later in the year with specialty clinic. There's a day of admin and learning as well. The precepted clinics, like I mentioned before, you work in teams of 2 or 3 directly with the preceptor. You build your own panel here, and you follow these patients throughout the year, and then you take them with you for your post-fellowship year of employment as well. In April of the fellowship year, you then develop what's called an independent clinic, in which you don't have a preceptor or a mentor kind of right there with you, and you see patients on your own. Similarly, it starts with quite a slow ramp up, just a patient an hour, and it caps out at 2 patients an hour by the end of the year. This is really intentional because we're trying to give additional opportunities for people to develop those foundational muscles for speed and efficiency in the clinic. And we obviously will provide preceptors and mentors who are available either in the same clinic or just a phone call away during those clinics, but no one's specifically assigned. Specialty clinics are an additional part of the fellowship, which is quite important. And they change year to year, so I'm showing the past 2 years of specialty options here so you can see. We're really fortunate to have a good amount of specialty care within our organization. That includes MAT treatment, psychiatry, endocrinology, rheumatology, and then obstetrics, gynecology, and midwifery. And we kind of offer fellowships, various experiences throughout the course of the year, including urgent care as well. A new offering this year. Here's some more additional specifics about the program. We do require you to have graduated within the past 24 months. We do not have a preference about an MSN or a DNP. You must be licensed and credentialed or eligible to be licensed and credentialed in the state of Illinois. So you can be in the process of completing those things before the fellowship starts. We accept family nurse practitioners, adult gero nurse practitioners, and we also accept physician's assistants. The language requirement is that you must be able to safely conduct a medical visit in Spanish without a translator. The salary and benefits, the salary is $70,000 for the first year. The second year is dependent on their other experience and in discussion with HR. You get 21 vacation days, additional federal holidays. There are good health, dental, and vision plans. You get 401k with match, short and long-term disability, employee assistance program, and reimbursement for your licensing and DEA fees. Application deadlines is for the 6th of May. Interview dates will happen about the week afterwards. We could do virtual or in person depending on location. And then the start date is the end of August, August 29th, 2002. And like I mentioned before, you can apply without having completed your board exams and licensures, but they must be complete by the day that the fellowship starts. And again, to reinforce this point, because it is quite essential, you must be fluent enough to do a medical visit in Spanish safely. And if anyone has any questions that, we can do like a quick informal Spanish check before your application to help you understand whether you would be or would not be eligible. The majority of our patients do speak Spanish, about 95% of them, they prefer that to get their healthcare in that language. If you do have any additional questions, you can email us at npresidency@esperanzachicago.org. I'm happy to answer any of those as they come up. Again, my name is Demetrius Markolides. I'm the program director of our fellowship, and I really look forward to receiving your applications and answering questions.